I noticed some problems with my thumb many years ago, actually, and it didn't cause a problem until the arthritis developed, got a little bit bigger, with that, the pain increased, and it got to the point where I wasn't sleeping well at night because the pain kept me awake. My benchmark generally is if it's keeping me awake at night, it needs to be addressed. And I also had a friend that had the same surgery from a different surgeon out of Appleton, and she did not have a good result. She had extended swelling. She actually had nerve damage in her first finger and her thumb. And so that kind of delayed my decision in seeking treatment also. I did explain that to Dr. Klika, and he was very patient and said that his technique is very different. It is supported by science and supported by research, and that I shouldn't have the same outcome. I waited a year after seeing him the initial time before I had surgery because of my apprehensions. But he was always very patient about it. And eventually I had surgery in December, and I've been released from physical therapy probably about 4 months now, and it's been very good. I'm pain-free. I did read his bio. I noted that he's part of a band, and that demonstrates right brain, left brain activity. It has a higher brain function to me, and I find that very intriguing and also really fascinating. And he's younger, so I think he probably has fresher ideas, newer ideas. And after my first appointment with him, I felt very comfortable with him as a surgeon. Dr. Klika is very calming. I mentioned earlier that I had some apprehensions about the surgery and the type of surgery and my recovery, and he just kept going over and over until my fears were calmed. And he's got a good sense of humor, and he explains very clearly, and he demonstrates using the x-rays and the MRIs that are available to him. My experience was very successful, I believe. I don't have any pain. The recovery is difficult, but it's so worth it. I believe in the RORA system and BayCare, and everyone is concerned about how you're doing and the follow-up and the phone calls. I wouldn't hesitate. If I had the same condition in my right hand, I wouldn't hesitate to have it done again.